Good morning, everyone. Thanks for joining us live or via the recording at a later date. My name is Michelle Priest, Interim Director of the Dental Assisting Program at IU School of Dentistry at IUPUI. I am a graduate of the program from 2002 and went on to complete my bachelor's degree, Health Sciences Education, in 2006. And started my teaching career at Ivy Tech in Anderson and their dental assisting program, and have been at IUSD since 2007, and just have a real passion for dentistry, dental assisting, the teaching. It's great. We've got a great program, so we're excited to share a little bit about it with you. We've got some students joining us, so after a bit we'll get them to introduce themselves. And so first we'll have Professor Alderson introduce herself.
Well, good morning. I'm Sherry Alderson. I also am a graduate of this program, and I went on to get my degree from IUPUI. So we're going to be talking about Earn While You Learn later on in this presentation, which is exactly what I did. As working as a dental assisting, I went on and completed my degree at IUPUI. I also worked 20 years in private practice. I worked in orthodontics, and I worked in hospital dentistry and as an expanded function dental assistant. And I've been teaching since 2001 at IUPUI, IU School of Dentistry. I primarily teach radiology, some other courses, medical emergencies, practice management, written and oral communication, and wherever else I can help out during the day. So we're thrilled that you joined us. We love this program and we want to share this information with you.
Oh, that was a great introduction, Professor Alderson. All right, we'll do student intros in a little bit.
Yes.
All right, so our little welcome slide. First little piece of the pie, and sometimes you never know what everybody's prior knowledge is of dentistry and all of the options for the members of the dental team and folks working in dentistry. So just a little laundry list of the options out there and the members of the team that you might run into in any given day in an office. Of course, we have the dentists, the doctors, dental hygienists. Typically, when you have your teeth cleaned, it's usually a hygienist. We're going to focus today talking about chairside dental assistants and expanded functions dental assistants. A lot of our students, myself, Professor Alderson included, have gone on to do some business assisting, kind of the front office business aspect of dentistry. And a lot of dental assistants will even go on to become office managers. Other things that assistants might do, some assistants work as sterilization assistants. Most of our graduates, because they're so highly educated and well-trained, will not do sterilization assisting because they have all the clinical training to be with patient care. But they're out there. And hygiene assistants are dental assistants that work specifically with the assistant, particularly now that we have some expanded functions in related to hygiene as far as coronal polishing and fluoride. We've got the laboratory technicians that make all of our fancy prosthetics, dentures, crowns, bridges. And there are a ton of other specialized roles that some offices employ and some do not, like public relations, marketing, treatment plan coordinators. They may have specific people just working with insurance and things like that. So there are lots of options working in dentistry, and you're here to learn about what opportunities are there for dental assistants. And so what is a dental assistant? This is a fun picture we took this year, our current class celebrating the Dental Assistants Recognition Week just a couple of weeks ago. Next few slides are basically language that we took from the American Dental Association page, the ADA, that has some nice bullet point lists of what does a dental assistant do. And a lot of folks will tell you that a dental assistant is the backbone of any dental office. Of course, we can't run without a dentist. We can't run without the hygienist and the business office. But the dental assistants, they're kind of the jack of all trades in the office, kind of making the whole thing run. So we have the chairside assisting, where we're there helping the doctor through the appointment with four-handed dentistry. We spend a lot of time in the program honing our skills for four-handed dentistry, so that back and forth collaboration between the dentist and the assistant, so that it's ergonomic, it's safe, it's efficient, and we can get through the appointment so that we can have better access to care and treat more patients. So we do a lot of chairside assisting with a variety of appointments. Underlined variety there because I think that's one of the best things about dental assisting compared to some of the other options in dentistry, is that there's a huge variety of duties and offices that you can work in. We spend a lot of time in the program learning about radiology, the science and study and technique of taking x-rays on the patient. And so that's a major function and role of the dental assistant and the hygienist in the office. We will spend a lot of time in the patient's records. We'll be reviewing their medical history, taking their vital signs, getting everything ready to go for the appointment. We will take a variety of different kinds of impressions and pour up with plaster products models of patients' teeth. This picture here is a model being trimmed to fabricate a bleaching tray, for a custom bleaching tray for a patient. We have a lot of communication that we have to do. We may be answering the phone, we may be communicating with patients, patients' parents, patients' guardians about what to expect during the treatment, what to expect afterwards. We may be in charge of ordering all of the equipment and supplies in the office. That might be one of the roles we take on after we've been working in an office for a little while. So you may communicate with a variety of people, the other professionals in the office, along with other dental industry like suppliers. And we also have all the specialties available. So you may be working in general dentistry, but you might work in ortho with the study of braces, and you may decide, I've been in ortho long enough, let me go work in pediatrics and help out the kiddos. So there are all the specialties available. And we will provide a lot of patient education. Sometimes the dentist does that, the hygienist certainly does that, but oftentimes the assistant will do that as well. It's really funny, we always tell our students this, and then when they finally experience it, they're like, oh, that is a real thing. Patients tend to be far more comfortable communicating and asking questions to the hygienist and the assistant. So the doctor will leave the room, and then the patient will ask all the questions. So we really have a major role for patient education and preoperative, postoperative instructions. Like if the patient is going to have some kind of surgical procedure, what do they need to know before and after the procedure? The assistant is usually the one to communicate that. We're also the infection control champions of the office. I know I mentioned that our graduates, because they learn so many other things, don't tend to work as sterilization assistants, but they do a lot of sterilization in the office. And you may be in charge of maintaining training records, developing your protocols. So it's not just keeping the instruments clean and the rooms clean. You may find yourself in a more significant role related to developing the training and the protocols in your office. There are tons of resources, and our students are really well educated and trained in these functions, so they know what to expect when they get out there. Another role for the assistant is just kind of helping the patient through the appointment. You may have experienced that as a patient yourself, that the doctor was very focused, and maybe they had great bedside manner, and they made you feel really comfortable as well. But oftentimes they're really focused on that tooth and that procedure, and the assistant can kind of take a more holistic approach to the appointment and not only provide the four-handed dentistry and assistance throughout the appointment, but also provide some emotional support and helping people with reducing anxiety and things like that during the appointment. And back to patient education, Although the hygienist will have a major role in oral hygiene, home care strategies for the patient, the dental assistant will also be well educated to understand those techniques to help patients learn how to better care for their own mouths. And so if you are educated as a dental assistant, what can you do with that? Our program is a certificate program, as we'll cover momentarily, but there are tons of opportunities for you. And so yes, you can come into the program, graduate. You don't have to get a bachelor's degree. You don't have to do anything else with your career. You can get right into the workforce after 9 months of education and work as a chairside dental assistant, an expanded functions dental assistant. And under chairside dental assistant here, I've listed most of the specialties. So maybe you're working in general dentistry, family practice, where they do a little bit of everything, but maybe you like to go work with practice focused on kids in pediatrics or endodontics. That's my main background. Most of the time that I've spent working in as a clinical or business assistant has been for an endodontist, and that's the specialty of root canals. Orthodontics, most people are aware, is braces. Oral surgery, all sorts of different surgical procedures, extractions and implants and other things. Periodontics is kind of the study of gum disease and the surgical and non-surgical approaches to helping patients that have periodontal disease. They also do a lot of implant surgeries in a variety of different kinds. Prosthodontics, a lot of prosthodontic offices run and function just like a general dental office, but the doctor has done a few extra years as a resident, as a prosthodontic resident, to have extra training in crowns, bridges, dentures, other facial prosthesis, and they may have assistants, hygienists, and everything just looks like a normal, regular general practice, except the doctor has a little extra training and may take on some more significant and tougher cases compared to a general dentist. And then we have our hospital dentistry that has a lot of different functions, particularly for the medically compromised and special needs patients. And so these offices are run out of hospitals. And then what if you do decide to stick around at IUPUI and we hope you do, to earn your bachelor's degree? That opens up many other doors, not just in dentistry, of course. A bachelor's degree will open up doors in many industries, but including the dental assisting certificate with your bachelor's degree gives you the employment opportunities such as educator, public relations, marketing, there's a whole industry for dentistry. So you've got all the companies manufacturing the materials, the supplies, the equipment, all sorts of different consultants related to productivity and ergonomics, and having an educational and work background in dental assisting plus a bachelor's degree opens up those doors in dentistry and in dental and health industry that you may not have without a bachelor's degree. Click the button. Come on. That's the problem with my computer today. As I hit the button, there's like a delay in moving on. I'm afraid if I keep hitting it, it's going to just advance forward a bunch.
We can wait a second.
All right, come on. Gonna make me lose my stride here, PowerPoint. Oh, well, this is embarrassing. There we go. All right, momentary fail there. Good thing we're recording. All right, so a lot of the things I just spoke about don't have salary information. This comes from the Dental Assisting National Board. This is the 2018-2019 salary survey. So they do these every couple of years, and they get national and state statistics on what people are making working as a clinical assistant in an office. And so the national average for everybody, any years of service, is just under $19 an hour. DANB certified assistants, and I'm going to get to that in a moment so you understand what DANB certification is, tend to make about $2 an hour more than non-DANB certified assistants. And in Indiana, for the average all over the state is, again, just under $19 an hour. And so that includes people in very rural areas that are going to make a little less, and people in the heavier populated areas of Indiana that are going to make a little bit more. That also includes people who've had no formal education and they're being hired at a pretty low hourly rate compared to people who have formal education coming out of our program. We're tending to see around $16, $17, $18 an hour for expanded in central Indiana. That goes down a little bit outside of Indianapolis. And then, of course, most offices are going to give yearly raises. So you can get into the $20 an hour range pretty quickly. So now you know a little bit about dental assisting and what it is and what we do, but why should you come to the School of Dentistry? Professor Alderson mentioned it, Earn While You Learn. It's one of the things that we are most proud of with our program, being housed within the dental school and on the IUPUI campus. We currently have 5 bachelor's degree programs at IUPUI that count most or all of the credits for the dental assisting program. Organizational leadership, it's kind of I don't want to say it's a business degree. It's definitely not a business degree, but it does go through a lot of supervisory kind of discussions and leadership and human behavior and organizations. And so it can just kind of help you learn the basics of kind of how people function in organizations, and it's been a great opportunity for graduates of our program. They direct admit. So once you're done with our program, you're automatically, all you have to do is contact the program and they automatically flip the switch and you're in the organizational leadership program. Health sciences is a bachelor's degree. It's a newer degree. It's been around a number of years now, but it's not one of the oldest degrees on campus. And it's a general degree for people interested in health-related topics. And they have several different certificates that feed into the program, and we are one of them. So they will count most of our credits towards their bachelor's degree. And I think several of our current students are interested or planning to pursue this. General studies is a great option. I know nobody graduates high school and nobody applies to college and just says, you know what? General studies, that's the path for me. I'm going to get a general studies degree. Most people don't think of it right away, but there are a lot of reasons to consider general studies. It can be a very flexible degree option for people who have been changing their major a lot, people who have been in school, they've had some credits here, some credits there. General studies can kind of help you pull them all together and kind of create a degree for yourself. Of course, there are some requirements as far as categories of courses, but they will accept 30 credit hours from dental assisting into the general studies path. Also, for anyone interested, please reach out to our program and I can show you the degree map that I have for dental assisting certificate plus the prereqs to go to dental school to become a dentist, plus the general studies, all in 120 credit hour bachelor's degree. So that can be a really great option for students who want to get their feet wet in dentistry with dental assisting and then pursue going to dental school. And we have several students. One of our graduates from a few years ago is actually a second-year dental student right now. And we've got several others that are finishing bachelor's degrees and the DDS prerequisites to apply. So I think this will become a more popular option in the coming year.
Excuse me, but we have one that's going to be a D1 in the fall, a first-year dental student in the fall.
Oh yeah, I forgot about that person.
Yeah,
I know you keep in contact with her more than I do, so I'd forgotten about her applying this year. So yeah, so we're just trying to populate the dental school in every way possible with our dental assisting graduates. A ton of our graduates work at the dental school. We have it's a great flexible opportunity while you're still in school to join the temp pool at IUSD for dental assistants. And so you graduate our program, you continue at IUPUI as a student, and then on the days that you're available, you let the temp pool know, and then you can be an employee at the dental school. So it's been a really great path for a lot of our graduates. The other two programs, public health and individualized major program, and that is kind of a create your own major program, and you work with an advisor in liberal studies to kind of design a path for the coursework, because the degree that you're interested in is not actually offered at IUPUI. And so it's a good option for our graduates because they can lump in the entire dental assisting program into that degree. So some other things about our program that you should consider when you are looking at dental assisting programs. We are fully accredited by the Commission on Dental Accreditation, CODA, which is the gold standard for dental assisting education. There are lots of programs out there in the state and in the country, and because Indiana doesn't have mandatory education for dental assistants, and there aren't a lot of rules about what you have to do in order to work as a dental assistant, there are a variety of programs, and they are not all equal. And so it's important for students to really evaluate what that program has to offer. And CODA accreditation is kind of the gold standard that lets you know it's the real deal. The education is comprehensive, and you're going to get what you paid for. We are fully housed within the IU School of Dentistry, which is a great benefit. We have one of our previous faculty, she calls it dental heaven. And I just love that because I agree with her. We are in dental heaven at the dental school. We have the brilliant minds of faculty, researchers, dental students, and residents from all different specialties and programs, hygiene, assisting, dentistry, and all the specialties. And so the collaborative opportunities and the exposure to dentistry that you receive going to school in a program in a dental school is excellent. And then because we're at IUPUI, not only are we with the dental school, but we have all of the IUPUI resources for our students, and our courses are all IUPUI college credits. And we do offer the expanded restorative functions elective. I'll talk about that in a moment. And the successful completion of our courses, you will earn the Indiana coronal polishing and fluoride certification. I'll touch on that more in a minute as well. There are certain pathways for becoming a certified dental assistant. That's the CDA, DANB Dental Assisting National Board Certified Dental Assistant. And one of the pathways is that you have to have graduated from a CODA accredited program. So because we're CODA accredited, students are eligible right away to become CDAs as soon as they graduate or right before they graduate our program. The clinical experience is one of the things we are most proud of in our program. We have at least 300, usually a little more, clinical hours, and that's direct patient experience. These particular images are images of a patient partner lab. These are all students and instructors for privacy, for HIPAA reasons. We can't show pictures with real patients of the dental school, but kind of gives you the idea. We do some hands-on on each other, not a lot, but we do a little bit of things on each other to hone our skills. But the clinical experience is just rich. We have most of it in the spring semester, where you'll have around 3 days a week in the clinics with the dental students and with the residents of all of the specialty programs. So it's just a fantastic clinical experience that we are really proud of. You want to add anything else about clinic, Professor Alderson?
Not at the moment.
Okay.
Thank you.
Put you on the spot there. So back to our expanded functions elective, not all programs offer this, and so it's a good reason to choose us. We do offer it. It's a 3 credit hour elective in the spring semester. It's a lot of laboratory work, but also has some clinical requirements. And this is the course where dental assistants learn to place fillings, restorations in patients' mouths. And this is really the best way to make money as a clinical dental assistant. They tend to earn a little higher salary because expanded assistants are directly impacting the productivity of the office. So what happens is the dentist will prepare the tooth, remove the cavity, and get the tooth all ready to go. All the diseased tooth structure is removed, and just healthy tooth structure is left. The dentist can move on, leave the room, start with another patient, help more patients in a day, and the expanded dental assistant will sit down in the operator chair and actually place the filling. The dentist will come back to check it for finality before the patient leaves, but the dental assistant will actually place the filling. And it's a great course. It's a great option for you to work as a dental assistant. And also we cover sealants, the preventive technique to help prevent cavities on the chewing surfaces of our teeth. So we spend weeks of the spring semester learning to do this, and then we start in clinic and place fillings on real people. It's a great course, and we have a lot of fun, some frustrations, but it's a great course, and I think that it's a good reason to choose our program so that you can kind of get everything that basically all of the general education you can in dental assisting. Which brings me to this slide about the certifications and licensure opportunities for the IUSD dental assisting graduates. So your certificate in dental assisting comes from Indiana University. And then, as I mentioned a few years ago, about 10 years ago now, a new law was passed that gave hygienists the ability for local anesthesia, so they can actually give the injections to numb patients in the office. And within that bill, dental assistants also got some new duties. Coronal polishing, the last part of when you have your teeth cleaned after the hygienist or dentist has removed any hard deposits from the teeth, the buzzing, the little polishing of the paste that kind of just takes a few minutes at the end of your appointment. Dental assistants can legally do that. And we can also apply fluoride, but only if you have the appropriate education and Indiana certificate. So we were kind of the leaders. One of our retired faculty, she pretty much designed the curriculum for the state of Indiana regarding these duties. And so it's just built into our program. If you have to come back to get it because you didn't graduate our program, and it'll cost about $850 to take those courses as a continuing ed student. But we just built it right into the program. We didn't add any fees, just part of the program. And that's, again, is just for Indiana. It's not a national certificate. It's just an Indiana certificate for those duties. And then, like I mentioned, we do offer the expanded function certificate if you take the elective. And because we require students to take the 3 sections of the Dental Assisting National Board to become a CDA, if you've been successful and passed those 3 exams, now you have your DANB CDA. And one of those exams, the Radiation Health and Safety exam, is required in order to get your Indiana Limited Dental Radiographer license, which is not issued by the school. And so the last two on this list are issued by other agencies, DANB and Indiana State Department of Health, but our program sets you up to earn those certifications and licensures. And so I mentioned a lot about the Dental Assisting National Board already, and so here's the slide on that. And so we refer to as DANB, the acronym, and they have several different kinds of certifications and a handful of exams, but the one that we focus on for our program for general dentistry is the DANB CDA, Certified Dental Assistant. And so there are 3 exams for that. Infection control exam, which students are eligible are ready to take at the conclusion of the fall semester after they finish their microbiology course. And that's kind of a cumulative exam of all topics for microbiology and dentistry. And then radiation health and safety exam, which we students are prepared to take usually sometime around in March or after the program, you know, any time between March and July of the graduation year is fine. And that, like I said, is the piece that is required by the State Department of Health to get your radiology license. And basically, if you don't have a radiology license, you are not employable as a chairside dental assistant, because most doctors really want their assistants to be able to take radiographs, to take x-rays in the office. So that is a really important piece. And Professor Alderson is our radiology champion, and she's really worked hard in this department, and we have excellent DANB scores for our graduates, and everybody's getting their radiology license. The last piece is the general chairside exam, which is kind of a cumulative exam of everything else that's not micro and not radiology that is taught in the dental assisting program. So students aren't ready to take that until nearly the very end of the program when they've completed all of their courses. And then we have a deadline of July 31st after the students graduate to give them a little wiggle room to study and take that exam. And again, everybody passing all 3 sections becomes a certified dental assistant, which isn't required. We get that question a lot. Do you have to be a CDA to get a job? And you don't. A lot of working dental assistants are not CDAs, and a lot of offices will hire people who aren't CDAs. However, having the CDA demonstrates to a potential employer that you were formally trained and you take your profession and your dental assisting very seriously. So it's a really good thing. It's kind of the gold standard in presenting yourself as a dental assistant. All right, they get the point. There we go. Okay, so more about our actual program. We are just a traditional campus program now. We used to have a distance learning program, and our last class is going to graduate this year from distance learning, and unfortunately we're not able to offer that in the coming year. Maybe someday we could bring it back, but that is uncertain at this time. So for the next for the class of 2021 for dental assisting, it's a full-time commitment to be on campus, basically Monday through Friday, like a 40-hour job. Classes are scheduled about 8 or 9 a.m. till about 4 or 5 p.m. Monday through Friday. A little bit of flexibility in that schedule in the fall, but not a lot in the spring. We have, you know, a jam-packed semester of over 30 credit hours that students will complete in 9 months. So we just don't have a lot of flexibility to give a lot of time off. So it's better if our students don't have to work jobs while they're in the program, but most of our students do. I did. I worked a job while I was in the program, you know, a part-time job. And so it works out. People just have to be good time managers to be successful in the busy program. We accept 20 students every year, and our application is currently open, and the priority deadline is June 15th. So we're accepting students, or we're accepting applications, and we'll make our admissions decisions after the priority deadline. So we just have one cohort every year, and they begin in the middle of August, usually about a week before IUPUI classes start. and students graduate in May at the same time as everybody else is graduating from IUPUI. We have 18 credit hours in the fall semester, and those are required courses. And in the spring semester, it's 15 credit hours if you're taking the elective of expanded. If you choose not to take the elective, then it's only 12 credit hours. So what do you need to know to get to us? How do you apply to the program? The very first step, IUPUI. Got to become a student at IUPUI. We don't have any control over that. Our students do have to be IUPUI students, and so you'll want to get your IUPUI application in by their May 1st deadline. And then, of course, to be accepted, and then you can complete the online dental assisting application, which is, there's a link to that from our program website. We do, because we don't have college prerequisites, we have to look at high school grades to keep the playing field even for our applicants that have had college and our applicants that have not. So we do require a high school transcript for all applicants, but of course, if you've been to college, we also require that and kind of look at everything. We'll only look at high school cumulative GPA. If that is by chance below 2.0, but you demonstrated success in college and you have at least 9 credit hours as a college student above 2.0, you will still be admissible to the program. And then we will pull out all of your English courses and all of your science courses and calculate 2 separate GPAs, and we lump them all in together, high school and college courses, and those GPAs also have to be at a 2.0 in order to meet the criteria for the program. We also require, just so you understand what it is that a dental assistant does and that you're really understanding what you're applying for, we require that you observe at least 4 hours in 2 different dental offices. Now, this current application cycle, we're going to have to get creative and flexible with this requirement because now is not the time to be an extra person in a healthcare facility. And so we will, if you haven't already completed your observations, we'll figure something out so that you have an equivalent opportunity to learn about a day in the life of a dental assistant without going into a dental office at this current coronavirus time. And it's not part of the admissions process, but just a side note that you do have to have all of your immunizations up to date before coming into the program. So all of that information is on our website and is sent out to students after they are accepted into the program. And so here's our contact information. We're just assisting.dentistry.iu.edu, and our email address and our phone number. Our administrative assistant who answers this phone is with the remote working, it's been kind of a challenge. And so don't worry if no one actually answers the phone when you call, leave a voicemail and your phone call will definitely be returned. So that's our contact information. And so again, just a reminder that the first step of the process is to apply to IUPUI. And so their admissions.iupui.edu is their website. They've got an email address and a phone number. They're located, this is an image of the campus center. So here at IUPUI, so they're located in the IUPUI campus center if you need to visit them in person, and they've just got great folks working in IUPUI admissions. So I think if you need any assistance with that process, they are there for you. And of course, things are not free, and so you need some financial aid resources. I always like to give a good shout out to the IUSD financial aid liaison. Jason Webster is who we have currently. He works for the Office of Student Financial Aid Services at IUPUI, but he is at the dental school, I think 4 days a week, maybe even 5 days a week now. And so the email address is dentaid@iupui.edu. And he's just amazing because he knows, he's been in the field for a long time, but not only does he understand financial aid for undergraduate students in IUPUI, he also understands the additional financial aid needs of people in dental programs. And so you might want to build in costs of national boards, costs of buying a laptop, costs of buying scrubs, those kinds of things. And so Jason has been amazing helping our students get through their financial aid needs. So anybody at IUPUI can work with Maine financial aid at IUPUI, but we always recommend working with the IUSD specific financial aid representative. And housing at IUPUI is really getting a lot better. We used to have just the one tiny little dorm hall, and so not very many students could live on campus in any given year. And now we have several really great options. It fills up fast. And so if you're considering living on campus, we recommend that you make those connections sooner than later. And then we're on social media. We've been doing most of our posting through the Dental Assisting Instagram page and the IUSD Facebook page, but we also are on Twitter and YouTube. So those, we've got Instagram and Twitter buttons on our website to get to our pages if you haven't, so you can follow us and get our announcements. And that's it. I'm gonna stop share my crazy computer here, and let's take it away for some introductions of our student groups. We've got some fantastic students with us. I'm gonna let Joe get us started with his introduction. He's actually a graduate, and then our three ladies who are current students right now. So Joe, please give us a little introduction.
Hey everyone, can you hear me?
Yes, hi.
Awesome. So my name is Joe. I'm originally from Cincinnati, Ohio, and I went to Ohio University for undergrad, and I received a bachelor's degree, and upon receiving that, I then applied to the assisting program. And I chose the assisting program because I wanted to have the on-hand clinical experience with the dental field before pursuing dental school, which is what I'm currently doing. This upcoming application cycle, I will be applying. I applied last year, and I did not make it, but hopefully this year will be a better turnout. I chose IUSD DA program in particular because they were CODA accredited, and it was really close to home for me. It's only an hour and a half from Cincinnati. And I do love that it's on campus, that it's fully integrated into the dental school, where not only was I getting the clinical experience that I wanted, I was also working hand in hand with dental students, and I could ask them questions. I could get feedback on the dental school life, the experiences that they have, and what to look forward to, and what to look for in other programs. So ultimately, my goal is dental school. And then I also work part-time as a pharmacy technician. That's currently why I'm in my car right now, because I'm outside Walgreens Pharmacy, and I'll be going in after this.
Okay, I guess I'm next. I'm Janae Johnson. I'm originally from Louisiana, but I moved here prior to high school, so I've been here for a minute. I'm currently a third-year student at IUPUI, so I'm a student at IUPUI and IUSD as well. And that's kind of the reason that I picked the program, because like Joe said, it's CODA accredited, but also you have that chance of earning your dental certificate also with your bachelor's degree. So I thought that was really cool. After this program, I do plan to go into hygiene or some other type of dentistry related career, whatever I dip into. But for now, it's dental hygiene, and I will be applying and waiting to see what they say. I do good.
My name is Melina, and I am from Indianapolis, Indiana. And I first heard about dental assisting when I was a junior. For one of our classes, we actually had to find some careers that don't require much education. And that's how I found dental assisting. And I'm a really indecisive person, so I felt like a one-year program where I'll actually get a certificate and can work would be perfect for me. And I chose, and what I like about IUSD is like I said, I came here right after high school, so I knew nothing about dentistry, nothing about biology or anything, but they like teach you everything in detail that you really need to know. And I feel like I learned a lot, not just about dentistry, but health science in general. And for the future, I do plan on continuing my college education, but I'm still really indecisive. So I'm just going to do something general while working as a dental assistant part-time.
I'm Maya. I'm originally from Utah, and I chose the dental assisting program because, sorry, I was checking to see if my mic was working. I chose the dental assisting program because I've always had an interest in dentistry, and I wanted to see what it was like, so I decided to choose this one and explore all the avenues that they have to offer. And I chose IUSD specifically because I wanted to see the different specialties that they have to offer. And I really like endodontics and prosthodontics so far. Those are my favorites. And after this program, I plan on temping at IUSD to get more experience at a place that I'm used to, at the pace that I'm used to. And I'll just continue pursuing my degree.
All right. Those were fantastic intros, everybody.
Yes,
Well, so our guests here, do you have any questions for the students? They told you everything you need to know. No questions. I'll give you a second to chime in.
I might have one question. I have some credits from the IU Kokomo, including like microbiology and things like that. Would those transfer over, or would I need to retake the class through the dental
So we
school?
don't transfer in any micro credits because our course is specific to dentistry. And so while you will do well in the micro course, we also go into the specifics that help you in clinical dentistry that aren't necessarily covered in a general micro class. So unfortunately, we're not able to transfer that in. So all of the courses of the program, except for expanded, are required.
Okay, perfect. Just wanted to check.
But prior to the program, we do have the option of, like if you're at IUPUI, you can just randomly take a micro class, like if you wanted to.
Okay.
I did. I took.
It gave me a fear of everything after taking it. I was like, don't touch anything. But I like it.
Yeah.
Yep. Micro ruins us for life.
I love that class.
Yeah. Oh no, I don't mean that as a bad thing. But it definitely changes how you view the world and how you clean things for the rest of your life.
I don't use handrails for anything. I'm like, I'll trip down these stairs before I touch them.
We understand.
During this pandemic is the most that I've used all my information that I knew from micro. I used everything during this pandemic.
It's so true. It's so true. And we were watching something and these two people were talking and they had masks and they just kept taking them off to talk and putting them back on. And we're like, we don't think that they understand the nature of wearing a mask. They don't get it. They don't understand. So asking the general public to wear masks is kind of an interesting situation. They don't really understand what they're doing and how to really protect themselves. What else? Anything else our student panel could share to help you make your decision or better inform you about the program?
I did forget to mention that I do also work full-time at the dental school. I work in the pediatric dental clinic. Before that, I had started working in the dental assisting pool part-time, and it was honestly a really great way to make ends meet while I was also retaking some courses for the
Learn
dental
while you
school
learn.
prerequisites. And I had a lot of extra spending money to spend on other things.
Anything else you guys want to share, since we didn't have a huge turnout of guests, but I think everybody decided they'd sleep in and take advantage of the recording. So since they're not here to ask their own questions, can you think of anything that they asked at the last session you might want to touch on, or the questions that maybe you had or I fell short of on the presentation?
Oh, there's one thing, just on the student aspects of things, like our professors are what's they called? Academic counselors, academic advisors, yeah. They are our advisors, so we always have them to go to, like, hey, I'm falling behind in this class, or hey, this is my percentage in this class, what can I do? So we always have them there to speak to and talk to. And they would know the best, since they are professors. They kind of know our progress in the class. So it's really good that we have them there to talk to them about the academic aspects of things, I think.
Thank you.
And if you have taken college courses before, it's a little different because you are with the same group of students for every class, pretty much the same time every day of the week. And so you really get to know each other instead of other college courses where it's a big lecture hall and you might maybe know the person you sit next to normally. So it's more of a camaraderie as a class instead of an individual.
Yeah, and because our classes are smaller, like I think there's only 14 people right now in our class, like we really help each other. We're all close. We help each other with the courses. During clinic, we give each other advice, stuff like that. So it's like a good support system, I think.
And it's fun too. It's just fun to be there. Like, give kids a smile. There was like a volunteer opportunity that we did at the dental school. That was really fun. There's food all the time. These lunch and learns.
Yeah.
Lunch and learns. There's food, and we just do things in class together too. So.
If you feed them, they will come.
Definitely, especially the good stuff. Chick-fil-A's, I look for those.
Oh, the power of a free lunch.
The only other question I kind of remember from the last time, a lot of individuals were asking about getting into hygiene after the assisting program. Some of the courses, do they still transfer or do they not?
They do. Within 2 years, because we take the exact same radiology course. We're not usually in the same room together for that, but the course directors, Professor Alderson and Professor Rader in the hygiene program, have worked together extensively to make the courses equivalent. And so the first semester of radiology, you don't have to take as a first-year hygiene student. Medical emergencies. What am I forgetting?
Oral anatomy.
Oral anatomy. You do take that course. It's a hygiene professor, and she teaches the whole cohort of the assisting students and the first-year hygiene students in the fall semester. So it's oral anatomy, medical emergencies, radiology the first semester. There's one more. Maybe there's not.
Is it Pat with Oldham?
Nope, it's just those three, but that's a handful of credits. So you don't have to double pay, and you get a little flexibility in that first year. That it's a hard program. I mean, they're both hard programs, but it gives you a little flexibility that you have already learned the lingo. You've already gotten some hand skills. You don't realize what you don't know until you come in, and then you realize when you start with the hygiene program that the other people who don't have any experience, and that's fine. Most people don't, but they're struggling a little bit more. And so I think that's a great benefit of the program to for both hygiene and pre-doctoral. So if you want to go on to hygiene program or go on to pre-doctoral program, learning dentistry is like learning another language, and just having that patient contact, those communication skills, just the teeth and the surfaces, and learning all that lingo, I think is really helpful. And you don't realize it becomes second nature, and you don't have to think about it, where starting in the program you really did. So that's a really good point. Thanks for bringing that up. Also related to your hygiene application, like Janae, who has applied to the hygiene program for fall of 2020, she's going to get a little bonus point on her application to hopefully bump her up in the rank a little bit, because she graduated from a CODA accredited dental assisting program. And so they do recognize how that kind of helps you out and helps you understand the nature of the program. And so they give that little boost to our graduates when they apply to the hygiene program.
And this program does come with a lot of, like, what can I say? Like, we get CPR, basic life saving, a radiology student permit, certificates. It comes with a lot of, what's the word I'm looking for?
Yeah, the add-ons, bonuses. Yeah, because the coronal polishing and fluoride, those are included, all-inclusive. They're not additional. Whereas if you went to a different program to get CDA'd and they don't provide you that, you would then essentially have to take a weekend seminar to do coronal polishing and fluoride and pay, what is it, $500?
$850.
Yeah.
$850. It's not cheap.
And if you come to this program, you essentially get it for free.
Not a whole lot of other things we can offer for free, but that one, we throw you a bone. What else, guys? Anything else before we call it a day on the panel?
I think a lot of employers too also look closely at their employees that are applying, and just seeing the IUSD name associated with your CDA or your EFDA would go a really long way in Indiana. I have a lot of contacts with graduated dental students who are now dentists that keep asking about the dental assisting program and the dental assistants, that how they want quality assistance, and they look for assistance from the dental assisting program.
Yeah, I've already had dentists like outside of the program, my personal dentist and stuff already say, oh, what, you're in IUSD? Yeah, when are you guys graduating? Because they're looking for us. They know that we're a good program.
Yeah. And when we went to that vendor fair, a lot of them were asking for our emails and saying, when do you guys graduate? Can you come work for us?
Yeah, I didn't mention that as it's part of the dental heaven experience of being at the dental school, is all of the networking opportunities, because you're there working with future dentists, and you're there working with part-time faculty who are running practices, and a lot of our graduates get hired that way. Our part-time instructor, not joining us today, she worked for over 10 years in private practice with a dentist that she met when she was a dental assisting student and he was the fourth year dental student. So they graduated together, and he hired her to start his practice, and they worked together for a long time. So it's a really great opportunity for employment, I think, coming through our program. We've heard time and time again that when they're looking at resumes, the IUSD resumes go right to the top of the stack. Professor Alderson, do you have anything to chime in on? I hate to put you on the spot again. I know the students have been awesome.
I think you did a great job of presenting the information. Appreciate our guests that have joined us, and our students and former student Joe. You guys did an exceptionally good job of presenting the information.
As in-person events, we now would take you on a tour. We'd split up in small groups and would take you on a tour of the building. So working remotely, this is a collection of pictures that one of the fantastic videographer, photographer, jack of all media trades, graphic designer from Dental Illustrations put together a collection of these pictures. And so just gonna kind of click through them. Hopefully my computer's not gonna cut out on me like usual. So this is a lecture hall. You guys can see, right? The screen is?
Yeah.
Okay. So this is just one of our lecture halls. We have 4 of them. 2 of them look just like this. Fancy rooms. They have outlets and connectivity from every seat. They're pretty nice rooms. In PowerPoint mode, not picture mode. Here we go. This is one of the walkways. We recently had a new addition, a huge facility, 114 extra dental chairs, the Fritz Clinical Center. So this is kind of the connection from the old building to the new building. And this is Fritz. So this is where we do most of our clinical treatment. This happens to be a picture of an operatory in the Graduate Endodontics Clinic. They've got a lot of fancy equipment. The endodontists doing the root canals, they're the ones, they're the true nerds of dentistry, I think. They've got a lot of cool fancy equipment, microscopes, electronic measuring devices, just all sorts of fun stuff. So interesting picture of one of their fancy operatories. So this is the first floor waiting room when you arrive and walk into the building for the first time. This is what it looks like. I have never seen it like this because I've never seen it with no people in it, but this is what it looks like. Another sign from the back of the building, all sorts of School of Dentistry selfie opportunities. Here's our little covered drop-off. We do offer a, unfortunately they have to pay for it, but if you have an appointment, I think it's cheaper. We have valet service for patients so that, because our parking for patients is in the garage across the street. So this is a little drop-off area, and also for people who are interested in valet. Another view of the drop-off. A view of one of the kind of aisleways in Fritz, kind of highlighting the privacy screens and things so that as you're walking through the hall, you can't really see everything going on in the clinic. Side entrance. Little outdoor space, and this is kind of a courtyard area that exists in between the new building. So what you're looking at here is the new building, and then not pictured on the other side of this grassy area is the old building. So the little walkway that you see. And so now we have some pretty nice tables and chairs. So when the weather is nice, people are outside eating their lunch, hanging out. Lots of people, we have lots of bike riders coming to campus, coming to IUPUI. So when they did the addition, they really beefed up their bike racks. Here's another view of that same area, just from standing in a little different location. Nice little kind of aerial view looking at the dental school. And this is the intersection of Vermont and Barnhill. This is the basement simulator lab. And because the dental programs accept about 105 dental students each year, they have this expansive 105 seat simulator lab. And so we don't do a lot of classes there, but we do classes in a third floor simulator lab that has 24 simulators. And so they don't look exactly like this, but you kind of get the idea that we can practice some of our functions, and working in kind of a simulated environment without a real patient gives us a little opportunity to make a few mistakes while we're learning. And they're the same situations. They have computer monitors at every station. So whatever's going on at the instructor station, students can see at their own stations. This is our administrative hallway. We've got a dental school library, which is pretty unique, and most dental schools do not have their own library within their school. So we're really lucky. We have an awesome head librarian that helps us out with a lot of things, and so it's a great space. And along in this hallway, they post pictures of all of the graduating classes of dentists, and then they also will highlight the current classes of hygiene and assisting in the hallway as well. This is a bench lab, and again, it's mostly used by the pre-doctoral program because it seats so many people, and so with only 20 or less students, we don't really have a need for this huge environment, but sometimes we do. We have used it in the past. We just tend to stick to the smaller room on the 3rd floor, and I don't think we have any pictures of that, so we included this to kind of give you a feel for, we have similar spaces for our program. They're just a little smaller since we're a smaller group. Got lots of, and so I think that's it. Yep, that's it.
I almost shed a tear looking back at clinic.
Oh, I know.
I looked at it too and I go, I miss this. I miss the space. I miss you guys.
I know. It's nice to see your faces online, but it's not the same. It's not the same.
We'll be back soon, we hope.
Yep. Well, that concludes our virtual dental assisting day. Any final questions or comments?
Yeah, I would like to add that even if dental assisting is your last stop in education, that's fine too.
Oh,
Because
absolutely.
Yeah, because I've met people who have been dental assisting for like 40 years and they love it.
Mm-hmm.
And the pay is good enough for them to, stay in that field for the rest of their lives.
Yeah.
Absolutely. My mother, sorry, go ahead.
I just said that was a really good point. Thank you for saying that.
Yes, thank you for bringing that up. My mother is a career dental assistant. She's retired now, but she retired from the dental school. She worked in grad endo, was the coordinator for over 30 years working at the dental school. And so, yes, absolutely. I'm sorry, I didn't mean to present that the only thing we care about is students that continue on at IUPUI for bachelor's degree, because that is absolutely not true. It's a great benefit for students who want to do that. But like Melina said, this is a one-stop shop. 9 months and you're in a career, you're in the workforce. And even though, no, you're not going to strike it rich and make 6 figures, as soon as you get out there, but it is a great salary for 9 months of education. It really is. So it's a great place. We definitely don't want to discourage anyone from coming to the program for certificate only. So I'm really glad that Melina brought that up, because we have in every class we have just kind of a variety of students in their educational path where this is the end for them. They don't want to continue on in school, but this is a great path to a career, and they don't want to continue on in school. So that's great, but we do have the other options for those who do. Thank you so much for bringing that up, Melina.
You're welcome.